Hi, my name is Patrick Alves, and this is my video recording for the Bioethical issue advocacy presentation for bioethics and healthcare class for Azusa Pacific University for the summer semester. Um, I'll currently be talking with Congresswoman Kim Young, who is actually a congresswoman in the city that I live in Orange County, California. So I will begin. Hi, good morning, Congresswoman Kim. Thank you for taking the time to meet with me today. I know your schedule is full, so I appreciate the opportunity to speak with you. My name is Patrick Alves. I'm currently a registered nurse with almost 6 years of clinical experience. I currently work in psychiatry, and I'm currently in the psychiatric mental health nurse practitioner master's program at Azusa Pacific University. I also live in Brea, which is in your district. In my work and training, I spend a lot of time assessing adolescents who are struggling with mental health issues, including gender dysphoria. I'm here today as a nurse and as someone who will be soon practicing as a psychiatric nurse practitioner in California. Personally, in my clinical settings, I regularly see teenagers who are in significant distress about their gender. Many of them also have other serious issues such as depression, anxiety, traits of autism, histories of trauma, or eating problems. These are very common in my practice, and I see them on a daily basis. It's very unfortunate that these people at such a young age are experiencing these difficult experiences, but that is why I find so much power and meaning in my line of work, because I'm dealing and having the responsibility to treat these people in a vulnerable stage in their lives and at a very low point in their lives. And it is my job, with my strength and knowledge, to keep them supported and keep them held up in this difficult time. What concerns me is that the path to medical interventions such as puberty blockers or hormones can sometimes move forward without a thorough independent mental health evaluation that fully explores these other conditions. I've sat with families who feel pressure to move quickly, and I've also sat with young people who later say they wished someone had slowed things down and looked more carefully at everything else going on in their lives. Taking into consideration everything that's going on in a person's life while they're experiencing these gender dysphoria issues, I find is extremely important. If someone is having gender dysphoria, we must not go into treatment right away, but we need to see what's contributing to these factors. A lot of the issues that these children face down the line after going through hormone or surgical procedures by gender-affirming care, a lot of them sooner regret these decisions. And that regret is stemmed from healthcare professionals not going into medical interventions very hastily without proper, thorough, and analytical assessment. As nurses, it's our job to protect patients, especially vulnerable ones. Right now, the system doesn't consistently require that kind of careful, comprehensive mental health assessment before medical steps are taken. I'm asking for your support for policies that would require a comprehensive mental health evaluation by a qualified mental health professional before any medical gender-affirming interventions are provided to minors. This is not about banning care. It's about making sure that every young person receives a full and careful assessment first, so we can understand the complete picture and can offer the most appropriate help. Stronger requirements for mental health evaluation will protect our children, support families, and give clinicians clearer guidance. And that is all I'm asking. I'm asking for requirements for full and careful assessments. I thank you again for your time, Congresswoman. I would be happy to send you additional information or connect you with staff, with nursing and mental health colleagues who are working on this issue. Please let me know if there's anything that I can provide on my end that will be helpful. I appreciate your consideration and your service to our community. Thank you.